So in the next graph, you can see that we've added a new point here called age of injury, the red point, which is at age 30, the age of our patient RG. And now you find out that subject RG actually really wasn't a normal control. He was normal until age 30 when he had a mild traumatic brain injury. And after that, he had multiple cognitive and other neuropsychiatric symptoms which persisted for years, in his case, eventually. So he's a fairly typical for one of our patients. And you can see that on the right-hand axis, we're back to brain volume measured as a percentage of intracranial volume. So his data up until the age of injury would map exactly onto the normal control data. But after the age of injury, they would no longer be valid in terms of mapping onto the normal control data. But we did measure his brain volume directly after the injury. Most of our patients, we measured brain volume within a few months or a year or two after injury. And so we can compare his brain volume measured after the injury to his brain volume estimated the moment before injury to look for change over time using the powerful longitudinal design that we've talked about in previous talks and published in previous papers. Now, which brain regions were we going to look at when we did these analyses? We looked at 4 brain regions, and that was based on what Hedman et al. Provided for us. Dr. Hedman et al. Gave us 3 brain regions we could look at. First of all, whole brain volume. Secondly, gray matter volume. And third, cerebral white matter volume. Well, we created a 4th region by subtracting whole brain volume and gray matter volume from whole brain volume and looking at what's left over. And this graph here shows you what's left over, which are subcortical nuclei like thalamus and basal ganglia, hippocampus, amygdala, as well as infratentorial regions, which includes brainstem and cerebellum. So this combined region, which we abbreviate as SCN plus IFT, was our 4th brain region. And here's an equation showing you how they're related. Okay, so when we looked at change of brain volume before and after injury in these regions, we found some very dramatic changes in our patients compared to normals. This is a graph of the change in cerebral white matter volume measured as percentage volume change per year. And you can see extremely rapid atrophy of cerebral white matter in the first few months after injury. Several patients are greater than 25 or 30% decrease of volume per year. The data follow an exponential curve, so after about 6 to 12 months it starts plateauing out. And although there's still atrophy, it's closer to a couple or few percent per year when you get out into several years after the injury. For the lower brain regions, subcortical nuclei and infratentorial regions, we also saw dramatic changes, but in this case we saw enlargement of these lower brain regions, especially close to the time of the accident. So within the first few months, there are a few patients greater than about 10 or 15% per year enlargement of brain volume. After the first few months, that also plateaus out and it follows an exponential curve. This finding was surprising because we didn't expect to see enlargement of brain regions, and to our knowledge, this is the first study which shows enlargement of these brain regions in patients with mild or moderate traumatic brain injury. We're not sure why these brain regions enlarge. One possibility would be swelling or edema, but that usually would occur very close to the time of injury over days or weeks and then resolve. We think perhaps more likely is that these lower brain regions are compensating for the deficits in the other brain regions. And there is some literature showing that when certain brain regions work harder, they can actually grow somewhat in volume. So that's a possibility, but we're really not sure what causes the brain enlargement in these patients. Now this is a summary graph showing the changes in the 4 brain regions before and after injury. So we're plotting brain volume measured as a percentage of intracranial volume on the left-hand axis or vertical axis, and years after injury on the horizontal axis. And you can see T0, which is the time of the injury, or the time just the moment before injury in our patients. In fact, for all the brain region measures at time 0, the patients start out with the same volume as normals. Along the top with the diamonds, from time 0 to time 1, the patients have a significant decrease in whole brain volume, which continues to decrease out to time 2. The next level of brain region changes we come to are the squares. And for the squares, the patients and the normals are almost completely overlapped. That's why you can't really see the normal squares, because the patient data overlay them exactly. And overall, patients did not change significantly with respect to change of gray matter volume. Just below that, you see white matter volume, which starts out the same, and then by time 0, we have a pretty large decrease of white matter volume, a significant decrease in our patients, which continues on to time 2. And then finally, near the bottom, we have the triangles, in which you can see increase, and it's a statistically significant increase of the lower brain region volume in our patients, which then actually reverses somewhat from time 1 to time 2. The patient's lower brain region volume starts approaching closer to the normal volume. And that change of direction also appears to be unique among brain disorders. So when we looked at this, we thought, wow, there are a few things here that seem to be perhaps unique for patients with traumatic brain injury. Number one, the extremely rapid atrophy of cerebral white matter regions. Rates of 20% per year or more are so high that if this occurred for more than a couple years or so, it would eventually be fatal. Fortunately, it only lasts probably for a few weeks or perhaps a few months at the most in our patients, and then it starts plateauing off. But still, it generates a signal there that can be detected with these methods that may be unique among brain disorders. Similar with the very rapid enlargement of the lower brain regions, the subcortical nuclei and infratentorial regions. Changes are so large that may be unique among patients with brain disorders. And then we have the opposite direction of changes of cerebral white matter shrinking or atrophying and the lower brain regions enlarging. To our knowledge, that's unique among patients with brain disorders. So we thought, wow, this might serve as a basis of a diagnostic test to be able to distinguish patients from normal controls and eventually patients from other patients with other brain disorders. So we did a statistical test to try to test this idea, and we used a statistical approach called logistic regression. And this is a model in which you enter your brain volume change measures, and then you ask the model, can you distinguish patients from controls based on this data? And the answer was yes. And to walk you through this slide, the model produced a formula that distinguished the two groups. And you can see that in the formula, it's mainly driven by the rapid atrophy of cerebral white matter. You can see that 59.6 times cerebral white matter. And next, it's driven also quite a bit by the rapid enlargement of the lower brain regions, the SCN plus IFT. And then finally, toward the end of that equation, it's contributed to a little bit, but still significantly, by atrophy of gray matter. And so when you use this equation, you can come up with predictor values for each subject, each individual patient, or each individual normal. And we did that. We tested each patient and each normal one at a time to see how well would this model distinguish between the groups. We found when we did this, using all the patient data, which is 26 patients in this study and, versus 20 normals, the test had 80% sensitivity, which is good, and 100% specificity, which is high as you can get. So these results meant the test was very good at picking up or detecting patients who had brain injury, and extremely good at identifying when subjects were normal. But remember, I showed you those curves where the biggest changes were close to the time of the accident, within 6 to 12 months or so, especially. And we noticed in our data, when you looked at the change of the logistic function predictor values over time, that there are very large differences between groups when you got less than about 1.5 years from the injury, especially less than 1 year of the injury. So we looked at our patients' data who had their MRI scan done within 1 year of the accident or injury. And when we tested them, 100% of them were identified as patients, and 100% of our normals were identified as normals. That means the test had 100% sensitivity and 100% specificity, which is as good as you can get. So we were, of course, excited by those results, and I don't know if this test would be 100% accurate if tested on the future on a lot of other patients. Probably not perfect for everybody, but we think that it probably will prove to be a very good test. We think it should be tested in other samples of patients with traumatic brain injury. We plan to do that ourselves, and we hope that other groups will do that as well. We also hope that it will be tested in non-traumatic brain injury groups in order to learn more about its sensitivity and specificity. But the bottom line of this work is that we appear to be able to take a single MRI scan of the brain done within 1 year after brain injury, and we can do a single test using 3 brain measures on that MRI, which will distinguish our normal control subjects from our patients with mild or moderate traumatic brain injury who have chronic symptoms with 100% accuracy. So we're excited about that, and thank you for listening.